Good afternoon, everybody. Amanda here, and I'm doing this video in the bathroom because my son is here and he's in the other room, so I'm just, giving him some privacy and so I can make this video. Alright, so I had said that I am now taking methadone for pain management, and this thing came with the prescription. And I just thought it'd be a good idea if I read it. It's a medication guide. That way people know about the medicine, instead of just, wondering or not knowing or, just getting that information so it's in your head. Alright, so this is for the methadone. It says medication guide, methadone, and then it says methadone hydrochloride tablets, CII. Alright, so the first part. Methadone is a strong prescription pain medicine that contains an opiate, narcotic, that is used to manage pain severe enough to require daily, around-the-clock, long-term treatment with an opiate when other pain treatments such as non-opiate pain medicines or immediate release opiate medicines do not treat your pain well enough or you cannot tolerate them. A long-acting opiate pain medicine that a long-acting opiate pain medicine that can put you at risk for overdose and death. Even if you take your dose correctly as prescribed, you are at risk for opiate addiction, abuse, and misuse, then can lead to death. Not for use to treat pain that is not around the clock. Also used to manage drug addiction. Important information about methadone. Get emergency help right away if you take too much methadone or overdose. When you first start taking methadone, when your dose is changed, or if you take too much, overdose, serious or life-threatening breathing problems that can lead to death may occur. Never give anyone your methadone. They could die from taking it. Store methadone away from children and in a safe place to prevent stealing or abuse. Selling or giving away methadone is against the law. Do not take methadone if you have severe asthma, trouble breathing, or other lung problems, a bowel blockage, or have narrowing of the stomach or the intestines. Before taking methadone, tell your doctor or healthcare provider if you have a history of head injury, seizures, liver, kidney, thyroid problems, problems urinating, heart rhythm problems, long QT syndrome, pancreas or gallbladder problems, abuse of street or prescription drugs, alcohol addiction, or mental health problems. Tell your healthcare provider if you are pregnant or planning to become pregnant. Prolonged use of methadone during pregnancy can cause withdrawal symptoms in your newborn baby. That could be life-threatening if not recognized and treated. Breastfeeding. Methadone passes into breast milk and may harm your baby. Taking prescription or over-the-counter medicines, vitamins, or herbal supplements. Taking methadone with certain other medicines may cause serious side effects. Sorry, the wording's a little small, so I keep forgetting where I am. Alright, when taking methadone, do not change your dose. Take methadone exactly as prescribed by your healthcare provider. Do not take more than your prescribed dose in 24 hours. If you take methadone for pain and miss a dose, take methadone as soon as possible and then take your next dose 8 or 12 hours later as indicated by your healthcare provider. If it is almost time for your next dose, skip the missed dose and go back to your regular dosing schedule. If you take methadone for opiate addiction and miss a dose, take your next dose the following day as scheduled. Do not take extra doses. Taking more than the prescribed dose may cause you to overdose because methadone builds up in your body over time. Do not crush, dissolve, snort, or inject methadone because this may cause you to overdose and die. Call your healthcare provider if the dose you are taking does not control your pain. Do not stop taking methadone without talking to your healthcare provider. After you stop taking methadone, flush any unused tablets down the toilet. While taking methadone, do not drive or operate heavy machinery until you know how methadone affects you. Methadone can make you sleepy, dizzy, or lightheaded. Drink alcohol or use prescription drugs, over-the-counter medicines that contain alcohol. Using products containing alcohol during treatment with methadone may cause you to overdose and die. The possible side effects of methadone are constipation, nausea, sleepiness, vomiting, tiredness, headache, dizziness, abdominal pain. Call your healthcare provider if you have any of these symptoms and they are severe. Get emergency medical help if you have trouble breathing, shortness of breath, fast heartbeat, chest pain, swelling of your face, tongue, or throat, extreme drowsiness, lightheadedness when changing positions, or you are feeling faint. These are not all the possible side effects of methadone. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. For more information, go to dailymed.nlm.nih.gov. This medication guide has been approved by the U.S. Food and Drug Administration. So I'll put the information in for you to go check it out if you would like. I just think it's good for people to hear, what the side effects are. Obviously, this is not in depth. It's just an overview of that. So just to give you guys an idea, it is like a heavy-duty narcotic if you take it in extreme doses. If you take it at a lower dose and you take it as prescribed, then it will work. I mean, it's working for me at least. And like I said, I don't plan on, she said, take it 3 times a day. I'm taking it twice a day. I don't want my body to build up too much. If I don't need it, then I won't take it. But if I start having that pain again, then I know it's there. You know what I mean? I don't want to become addicted. I don't want it to overtake my body. But anyway, I hope this was helpful, and always look at the side effects and whatnot of any medication that you take, whether it's psychological medication or other types of medication. Please do your research. Know about what you're putting in your body and how it may affect you. Make a list of questions, bring it into your healthcare provider or whoever it is that you want to ask. And just make sure that you know what you're doing. It's important to be informed. So this is why I made this video, to help inform you guys. And then you guys can take the information and, apply it, if you wish, to being more insightful about your treatment. And also, at any time, you can request a copy of your medical records, to see what's going on and all that stuff. And you also have patient's rights. So you can always go to your provider and say, I'd like a copy of my patient rights, and they have to give it to you. So just keep that in mind, and, I hope this was helpful. I hope that you at least, look up the stuff. If it's not for you, that's okay, but just be careful with medications. Please take them as prescribed. And if you have any problems, please call your doctor, and then, go from there. So I'm going to go. I have to go do something. I have errands to do, so I'm going to say goodbye. Again, I hope this was helpful. Thank you for watching. I love you all, and enjoy your day. Bye.